Guys and girls, what is going on? Welcome to Titan Talk Tuesday with me, John, CEO of Titan Medical Center. And I'm going to stay on here with you guys for about a half an hour today and talk about a couple of the different things we got going on. Obviously, the blood work special. This is the last day for it. So males, you can get it for $130. The in-depth blood panel, from Titan Medical Center. Females, it's $200. There's more tests on there. That's why it's a little bit more money. But it's better than paying $200 or $300, right? Because $200 would be the regular guys test and $300 would be the girls. So you're saving some money, you're getting some value out of it. See what's going on inside. There's a lot of people that complain about a lot of different things. And one of the biggest two, I guess three if I really wanted to name some complaints. One, I want to lose weight. How do I lose weight? Because I don't know how I gained all this weight. I don't know how I'm going to lose it. How am I going to lose it? Two, how can I get more energy? I'm dead when I wake up. I sleep 8 hours. I don't feel refreshed. I feel like a zombie unless I take Red Bull like 4 or 5 times a day, Monster, Celsius, whatever you're choosing out there, or you're doing something else that's keeping you to stay up. Right? You don't want to do that. You want to make sure everything you're doing is healthy. So that's where blood tests can really find out what's going on inside, whether it's a hormone that might be deficient or off balance. Or, hey, listen, maybe vitamin D is low. Maybe B12 is low. Maybe these things need to be checked, right? Because we don't check these things. Most people out there do not check what's going on inside. And if they do, it's very, very, very limited. So what do I mean by that? I mean by, hey, listen, you might go in and you might go see your general practitioner, family doctor, primary care, whatever it is, and you might go see him every single year. And every single year, you get a physical exam, right? They go over it. They do a little bit of blood testing on you. Doctor looks over your body, makes you cough, listens to your lungs, all that good stuff. But what are they really looking for, right? And what can they really see with the limited testing that they're doing? And the majority of primary cares or your general doctor is going to run like a comprehensive metabolic panel. It's a CMP. And usually, if you get a good one, there's 14 tests in there, and we have that. And that's going to cover your liver, your kidneys, your electrolytes, your fasting glucose. And then we talk about, a CBC, a complete blood cell count. And this is going to look over white blood cell count, red blood cell count, hemoglobin, hematocrit. And they check this because they want to see, hey, listen, is everything okay? Is there infection? White blood cell count being high can obviously be a sign of something going on inside, obviously infection or something else. The last thing that they usually test is cholesterol. So they usually do a cholesterol panel, good cholesterol, bad cholesterol, triglycerides, total cholesterol is usually in this. And that's it. Unless there's a complaint where they have to go down the path to try to find out what that complaint is, they're not going to really search, and they're definitely not going to run these blood tests right off the bat. And the reason most of them are not going to run them right off the bat is you might be using insurance. See, using insurance puts you in a category where you have to abide by what the insurance company is going to cover, and you have to jump through the hoops to make sure you can go to the right doctors that you want to go to. So at that point, if you want to get it through there, they have to produce, these codes that they get reimbursed by. If these codes get kicked back or the insurance company doesn't like it, then you're on the hook for the expensive test that you're going to run through your primary care general doctor. They're not going to cover it, and they're definitely not inexpensive like what we're going to give you. Even if you were to do just a CMP through us, it's $25. It's very, very inexpensive, whether you want to do a single test or you want to do the in-depth test. So I would definitely take advantage of the blood work special nationwide, wherever you guys are at, whether you're a new patient or a new person that says, listen, I want to see what's going on. I don't feel right. I think things could be better. This is you. This is for you guys. For old patients or patients that are current, listen, if you want to see what's going on, let's do it. If not, you can always put this in your profile and use it when you need it. So if you're a hormone replacement therapy patient with Titan Medical Center, you know that you're going to get at least 2 blood tests a year for us to check to see what's going on and 2 consultations. So you can automatically get an inexpensive test like this, put it away, use a discount, and use it when you want to. So, yeah, unless you're a veteran. Veterans get discounts too for sure, all the time. So, I want to take care of my veterans out there. I think we need to take care of our veterans out there. That's a big one, especially with everything that's going on, our current environment in our country. I see a lot of people that are not U.S. citizens getting a lot of big benefits from the governments in the United States, whether it's local or federal. And at that point, like, we need to take care of our veterans and our homeless. But our veterans have already served our country, right? So I would put a priority, and I shouldn't really, but I put a priority to our veterans because, these people have sacrificed time in their life. A lot of these people have put their life on the line. And at that point, that's something that, not the everyday person does. So at that point, we want to make sure that we recognize them, and we should be taking care of them. If there's homeless vets, we should be able to create veteran homes. And veteran homes should be able to put these homeless vets in there. We're spending all this money on everything else. We might as well spend some money on our own country and our own veterans that served our country. And then start maybe, taking care of the rest of our homeless population out there, because it's just growing more and more. So I'm sorry to get off topic, but I think this really needs to be talked about because, at that point, there's a lot of bad things going on out there. And, not everybody's tuned in to what's going on because not everybody wants to see what's going on, right? It's that bad, and just kind of turn a blind eye to it. But we need to look at these things, all right? It has to do with our health too, mental health, right? Because, you see a lot of these people or a lot of negative things or a lot of down things and stuff like that. That's not good, right? That could put you in more of a down, melancholy mood if you really, really have emotion or attachment to whatever it is. So at that point, we got to make sure our mental health is good too as well. Esquire Broker, how you doing? I hope all is well. Jake Jacobs, what's going on? DJ J9, what's going on? Rose Worth, what's going on? How you doing? Harold, how you doing? Solomon, how you doing? Everybody else, thank you guys for joining me. I really appreciate you guys joining me. And so let's talk about this. So the next thing I want to talk about is I want to talk about IGF-1. IGF-1 or IGF-1 LR3 is what we offer, but there are two versions. There's IGF-1 and IGF-1 LR3. We only offer IGF-1 LR3, We had both, but most people go with IGF-1 LR3, and the reason is because it lasts longer, has a longer half-life in the body, so it's going to work longer. So that means it get you way better results. Now with this, IGF-1, what is IGF-1? Because a lot of people may not know what IGF-1 is. So IGF-1 stands for insulin-like growth factor 1, okay? And where is insulin-like growth factor 1 produced? So what happens is your growth hormone is in your pituitary, and then it travels down into the liver where it converts. And what does it convert into? This is where IGF-1, 2, and 3 come from. Now, you're saying, well, what about IGF-2 and 3? Don't worry about those. We need to focus on IGF-1. IGF-1 is going to give you all the benefits of growth hormone. So people out there that are getting growth hormone from shady places might not know really if it's real, because the real stuff is going to cost you a pretty penny. It's not cheap, okay? Now, maybe the stuff that you get from China, different cap tops, whatever you guys are doing out there, might be $300 or $400. Real growth hormone is a lot more expensive than that, especially at some of the doses I see people taking out there. But why not use IGF-1 LR3 instead? It's a fraction of the cost, and it works a lot faster. And what do I mean by it working a lot faster? So when we talk about a race, we talk about going from a starting line to a finish line. And through that race, we're going to have to go through this trail, right? That's growth hormone. Now, IGF-1 LR3, we start at the finish line and we jump all the way, we start at the starting line and we jump all the way to the finish line. There's no in-between trail. So at that point, we're getting the goods right away, getting it working right away. That's what we want. David asked, what is IGF-1 used for in therapy? So this is a great question. So the reason IGF-1 is used for therapy is because we need something that's going to help IGF-1 levels. We have to have something, we want to have something for anti-aging purposes, but, we have all these different things, and we don't prescribe growth hormone. So this was a really good substitute. This or testosterone, I think, would be my go-to, right? And I use IGF-1 LR3 all the time myself. So it's a really good therapy to be able to utilize on and off. There's great benefits. It doesn't shut down the pituitary function either. So when you're taking this, if you come off, it's not going to downgrade your growth hormone production. It's not going to stifle it or suppress it. So that's another big benefit. But used for therapy, it can help laying you out. It can help grow lean mass. It helps with anti-aging properties, hair, skin, nails. Should help with sleep patterns. All these different things, which you read about growth hormone or IGF-1 levels, that's what it is. Imagine Shield. I am not Michael Hearn. Michael Hearn, me and him usually do our Titan Talks on Tuesday too as well, but Michael Hearn is traveling to Dubai for his bodybuilding show out there, and we've got a couple other things that we're working on, so he's out there representing. So we will be back next week with a full episode. Doesn't IGF cause bubble? He put gum. Imagine show, doesn't IGF-1 cause bubble gum? And what he put underneath was gut. So the thing about growth hormone, right? Because usually it's a lot of people that take growth hormone. And, growth hormone has IGF-1, 2, and 3. Now, 2 and 3 usually can affect the gut area. And if we're taking a lot of it, because that's the key, right? Imagine, is if you're taking a medical dose, or are you taking a super exogenous dose, right? And at that point, you're taking that super exogenous dose, what bodybuilders do, and that's where they get bubble gut. That means what happens is their vital organs and everything inside starts growing, and it gets bigger and extends the gut. And that's how I would phrase it: extended gut, not bubble gut. Bubble guts means, you might have ate something bad and you got popping in there and you got to go to the bathroom. Extended gut means that, hey, listen, your gut extends over where it should, right? And that's what happens when, your intestines grow and everything else grows. So use the right way and for the right practical treatments. This is great. Anything abused can be harmful or do negative side effects to people or things or anything else. So let's not really focus on what it is. I mean, I guess to a certain extent, maybe you should, because you don't want to take like poison or anything in a little amount. So, but hey, listen, if you eat McDonald's, you might be doing that already. All right. So next one, Phil Gracia said, IGF-1 used in anti-aging treatments. Absolutely. IGF-1 is used in a lot of anti-aging treatments. Obviously, as we grow older, we start to break down. We start getting older, we start aging, we start withering, and then we die. So at this point, we want to try to slow down that clock or try to reverse that clock. This can help with that. Can IGF-1 be attained naturally? So naturally, no. You have to see our medical provider, fill out the new patient paperwork. With IGF-1 therapy through Titan Medical Center, you do need to do a blood test. We got to check some different things, make sure you're good there. And you'll be good to go. It's very simple, very easy to do. You guys are going to love it. What is the role of mindfulness-based therapy in mental health treatment? I don't know. Like I said, that's a little bit outside of our wheelhouse. Mental health, though, you got physical health, mental health, sexual health, emotional health. So, and I guess mental health can go with emotional, I guess. But at that point, you want to make sure everything is good, right? Not just one. Physical health is great. Be in physical shape. But if mental health is not there, sexual health is not there, excuse me, then at that point, you got to make sure, you're taking care of yourself, basically, right? And if you need to go talk to somebody, then that might mean something you need to do. Now, a lot of people might have depression, right? Now, if you have depression and there's nothing for you to be depressed about, you might want to check your testosterone levels or hormone levels. If these hormones are off, you can feel depressed, down, suicidal thoughts, all these different things. So, excuse me, I would definitely check on your blood work, make sure everything is good there, and then move on. If you need to talk to a counselor, a therapist, or whatever it may be, do that too as well. Cabrina, no problem. You're very welcome. Bella said, you're awesome. I appreciate that. Jackie Mon, thoughts on baking soda as a pre-workout? I don't think I would. Yeah, I definitely wouldn't use it. I would use Hercules Potion for sure. Samuel Garcia, you will get blocked saying things like these. All right? Don't say things like that. That's not nice. That's not nice, guys. Be nice on here. Okay. All right. So let's talk about some other things. So testosterone replacement therapy. I got about 13 minutes with you guys. If you have any questions, shoot them out for me. I'd be happy to answer them for you guys. So when we talk about, hormones in general, and I don't think I ever really get into this with you guys, but hormones really regulate everything in the body, a lot of different things in the body, and obviously direct things what's going to go on. So we really want to check these things out. Now, hormones that maybe you want to check or things you want to check outside of what we do in a full in-depth panel. Big shout out to Eric from Coastline K9. He's the one that brought me my beautiful girl, Sasha. She's the best ever. And Eric, I need to get in contact with you possibly about getting another one. I lost one of my dogs recently. I lost my American Bully. My family wants to get another puppy dog. I want to get another trained dog. So I'm going to try to get both. But I need to talk to Eric about this because I already have 2 dogs at home. And I got to make sure they're going to integrate properly and work together. So I definitely need to get with you, Eric, for sure. Now to TRT IGF-1. No, it's all good, brother. I appreciate it. How do therapy and medication work together? Well, our therapies are a medication. I got that question the other day. What is a therapy? And I'm like, well, therapies are medications. I just try to use a little bit different verbiage because social media is very sensitive about these things. So at that point, therapies are medications. Back in my regimen now that I hit my weight loss goal. Awesome. That's awesome, Eric. And so TRT. All right, wait. And we got another question. How long do you recommend someone stay on testosterone? When do you see body fat loss results? So you can stay on it for a long time, right? You don't have to get off it. You can stay on it for a short time. Now, when you're really going to see body fat loss results, you should start seeing within the first 60 days. 30 to 60 days, it should start moving the needle. And this is what I was saying, KR, is that basically, with IGF-1 levels like this, recovery should be better. All these things should be getting better. It's like more of an anti-aging thing. So on testosterone, I don't know if you did a blood test prior or not, but, if you're like, hey, listen, I want to see if this is working, we can run just an IGF-1 test, and it'll show you right there. Because every patient we put on testosterone has been very, very happy, got really, really good results. And testosterone is just a game changer in itself. Now, it is a GHRH. So, if somebody didn't want to take IGF-1, they could take testosterone. It's going to naturally raise their growth hormone levels, and it's going to do something else that nothing else does out there. And it targets visceral belly fat. The clinical studies targets visceral belly fat. So, you can say that. It's FDA approved to do these 2 things. So, when I start looking at some of these different things like that, testosterone is up there. And it's a great tool in the tool belt to be able to utilize, 1, to build lean body mass, 2, anti-aging, recovery, all that good stuff that goes with it, with IGF-1 levels being, above range a little bit, or even higher than what they were. Like some people, or most people, I should say, are in the middle of the reference range. So let's say it was 70 to 250. They usually come back at 150, like right in there somewhere, 125, maybe 150. But, it starts going down and down over time. So that number is going to lower. Now, can that number come up? Naturally, yes. So, with patients that are on, TRT, before they go on TRT, if they have low testosterone levels, when they go on treatment with testosterone, that might bump it up. Now, I'm not going to say it's going to bump up 100 points, but it might bump it up 10, 15, 20 points. There's other things that could possibly do this too. Living a healthy lifestyle could possibly bump this. Not eating correctly, sleeping's a big one. So if you're getting the good amount of sleep or the ample amount of sleep that you need, then you might be a little bit higher in IGF-1 levels. This could also be determined by genetics. A lot of the things that we're talking about can be determined by genetics. It's who you come from. It's your DNA, right? Not yet. Well, they're changing DNA with CRISPRs, but at that point, we don't got to the public yet where we're able to do it. But there will be a time in the future where we're able to change our DNA. Our DNA can change. It can get disrupted already. We know that. When we talk about some of the different things that are going on in our body, DNA can be affected. So, and everybody thinks, wow, DNA can be affected? That's crazy. And yes, it can. So, we really need to make sure that we're taking care of ourselves. I don't think that we're taking care of ourselves as much as we possibly should be. And, I'm not getting into politics or anything like that, but, I do think that we need to look at some of our main agencies as far as the FDA, some of these 3-lettered agencies and see what's going on and make sure that we're protecting people. We should be able to look at things and say, hey, listen, it's not big pharma just controlling this, or are these foods really healthy to be giving the American people? When we talk about some of these different countries, all the different countries, all of them, and I'll just say from Mexico per se, right? Or even England, When we talk about red 40 and these yellow, whatever, 10 or whatever it is, these chemicals, and then we talk about high fructose corn syrup and corn syrup and whatever else they disguise it by. These things are poison, and we're eating these daily and feeding these to our kids daily, and they're growing up on these processed foods. And so all it's doing is creating disease and negative health for everybody, whether you're young or you're old or you're right in the middle. So at that point, we really need to take an eye on what we're eating and how we're eating and how we're taking care of ourselves. With the potential side effects from IGF-1 therapy. So there is a potential side effect, and I always tell everybody this. And this is why you do a medical consultation, you do blood work for this therapy. The big thing with this is that we need to see what's going on in your past. Have you had cancer in the past? Is your family a high risk because they've had, or did your family have cancer to put you at high risk for cancer? Was that on both sides, one side? What kind of cancer was it? Because when we talk about IGF-1 or any GHRH, growth releasing hormone peptide, or even growth hormone, we're talking about stimulating cell growth, okay? And when we start talking about stimulating cell growth, our body produces good cells and it produces bad cells every single time. And good cells usually, go on, and bad cells, usually your body picks up on it and eradicates them, right? But sometimes these cells get by. And as they grow, they can grow into tumors and cancer and all this other stuff. So that is one potential side effect. If you're at high risk for cancer, we don't want to give you something that might expedite and fuel that cancer. And that is a potential side effect. Other than that, you might get a little irritation in the injection side. I'm just covering basic side effects, things like that. I don't think there's any other really big negative side effect other than that, possible. And that's your family history, health history. If you're healthy as a horse and there's nobody in your family that's had cancer, as far as mom, dad, whatever, then you're good to go. And even with me, my dad has colorectal cancer, but I didn't find out till, I'm 43 years old. And he didn't find out till he's 71 years old. So there's nothing I can do now. I've already been on GHRHs, IGF-1s. All I can do is test and get scans for myself. And that's the other thing. I'm not just telling you guys to do this and me not following the example or leading by the example. I'm actually doing a lot of these different things I'm telling you guys to do, or I've seen this personally, and I want you guys not to make the same mistakes as a lot of people out there, okay? Do you notice any side effects coming off of it? Absolutely not. There's no side effects coming off of it. Now, if you're talking about testosterone, KR, or you're talking about IGF-1, either one, there should be no side effects coming off. They might help you sleep a little bit better, but I don't think it's going to be a big game changer as far as your sleep. And if you've gotten to a healthy sleep pattern, routine, usually you can stay on it, okay? So let me know if there's any problems or anything else. Noah, how you doing? I hope all is well. Is there any comments anywhere else? I got about 4 minutes for you guys. Is there anything else you guys would like to hear about? Or compared to other treatments for muscle wasting? Oh, there's actually another question. Does IGF-1 therapy compare to other treatments for muscle wasting? Absolutely. It actually is prescribed to a lot of HIV patients too as well. The reason is because HIV cocktails, these medications, when you think of an HIV patient or somebody who has AIDS, they're usually pretty thin, right? Well, these cocktail of drugs will actually put adipose bad fat on the body of these patients. And this will combat that. And that's what it was made to do. So that's the reason behind it. Oh my God. Wow. I'm getting a lot of sexual comments today. How much does IGF-1 therapy typically cost? Thanks, Brian. So IGF-1 therapy usually costs, there's 2 different doses. There's our level 1 and our super tight level 2 dose. So you're talking about like $350 up to like $550. Okay. And that's very, very inexpensive to a lot of people out there and kind of what they're selling it for. And compared to any growth hormone or anything out there, they're going to get. Is there a risk of cancer with prolonged IGF-1 therapy? Sorry. Now, obviously, listen, the longer you do something, usually it grows, right? And keeps growing. But here's the thing. If you got cancer, it's going to grow, right? Prolonged use, usually we don't recommend that anyway, because you should only take IGF-1 therapy for so long. The reason is because you have to give your body a break, because you'll desensitize to its use. That means you won't get all the benefits you really want out of it. So you want to stop it after so long, which we'll tell you to do, and then you can get back on it after a month or so. So I would first do that, and I don't think you're gonna have any problems. Hey John, I have 2 questions. I'm on testosterone and tirzepatide, but I read that testosterone increases appetite. Is there a conflict? Absolutely not. Testosterone is not going to increase your appetite like that. MK, GHRP 2 and 6, yeah, they're going to increase that appetite like through the roof. Testosterone, no way. And honestly, I think this is one of the best combinations out there for people to get, Chris. The reason is tirzepatide. And tirzepatide is going to, it's going to curb your appetite. It's going to slow down digestion. It's going to release micronutrients evenly, disperse them evenly for blood sugar levels. But testosterone is going to raise IGF-1 levels, which in turn, if he's going to a calorie deficit and he's probably trained a little bit, he's not going to go into a catabolic state. He's going to hold on and retain that muscle. He's going to recover faster because of it. And he's going to get an added benefit with weight loss directly targeted at the adipose tissue in the stomach. Game changer. How long can one be on a GLP-1? You can be on GLP-1 forever, Chris. Those drugs were made for type 2 diabetics, and a lot of type 2 diabetics never get off treatment because they don't change things. And they use those drugs to counteract their diet because they've never changed their diet. So you're good to go with that for as long as you want to. Katerina, you're welcome. Chris, you're welcome. Ronnie, love from Canada. We appreciate our brothers over there in Canada. Thank you. I wish I could service you guys. I got a lot of people over there always ask about Canada and some different countries. I'm trying, guys. I promise you. I'm even looking at Dubai. That's why Mike's out there too. He's going to look at some different things for us. So I want to get Tight Medical Center out there, and you guys, spread the good word for me, please. All right. I appreciate all you guys. Thank you. I'll be back next Tuesday for Titan Talk Tuesday with me, John, CEO. I appreciate it. I'll try to keep it at the same time, maybe at 1:30, and go with Mike afterwards. So let me know if this time works for you guys, if you guys like it. And if you guys do, then we'll continue at this time. I appreciate you guys. I'll be back next week with another Titan Talk Tuesday with me, John, CEO. Thanks, guys.